welcome back to the Tooth Doctor Edmonton YouTube channel. We're so glad you joined us today. Today I have Cindy from the Tooth Doctor. She is a receptionist here. Are there any other things you do with the...
I help with the sterilization and with the insurance and all the payments and stuff like that.
Wow, you make things tick around here. That's awesome. Well, today we're going to be talking to the expert here on dental insurance questions. A lot of us have these questions and we don't always know the answers, so it's really great that you can break some of it down for us. So I have a quote I want to share, and it's unknown who said it, but it goes like this: a good dentist never gets on your nerves. True?
Yeah, sure.
Health Canada says that 62% of Canadians have private dental insurance, and 6% have public insurance. 32% have no dental insurance. Those are some interesting numbers. A lot of people have actually that extra coverage, which is great. Mm-hmm. So why isn't dental covered by our universal healthcare plan in Canada? What are some of the reasons?
Well, back in the day, it was covered. Canada did cover dental care system for their citizens, but now it was cut back to bring us out of the debt. Mm-hmm. And they had to cut back on some healthcare systems, and to reduce tax costs, they had to cut out of like public systems or healthcare system or educations, but still they do have provide supplementary care for low incomes or even for seniors. So they do provide for people who are kind of struggling with their position or their situation. But yes, the government maybe thinks that people can take care of their own health, oral health, like brush your teeth, floss, and you will have good dental care. But they had to sacrifice healthcare system in order to bring Canada out of debt.
Right. Yeah, there is always a trade-off there. Yeah. Mm-hmm. Is it quite common for people to avoid dental treatments because of the cost?
Definitely. The first question that I get over the phone is how much is this? How much will it cost me? Like, even if they have dental insurance, that's number one question that they bring up.
For sure.
And obviously, like, that would be my kind of number one question if I wasn't working at a dental office. If it costs too much, they might say, oh, I'll come back for that. Or if it's an extra treatment, for example, for like providing fluoride or polish for like, after doing cleaning, they might say, oh, I'll pass this time, I'll get it after 6 months. Or, they might not do it because it's an extra, couple bucks there. So definitely they might say, I'm going to come back and I'll come back when it hurts more just because of the cost. And, I totally understand. It's their own, body. It's their own like oral system. Like we can't say, oh, you need to do this. So like we won't force them to do some things. Mm-hmm. If it's within, safety, and if we would kind of lead them the way to what is good and what is not. But, if it's the cost that's the problem, sometimes they want to come back, or, there are certain stuff that they are not willing to do because of the cost, definitely, yeah.
Oh, okay. For sure, I actually agree with that totally. Mm-hmm. Are most dental plans the same?
No, actually, it depends on which insurance carrier you're with, and it also depends on what kind of company you work for and how long you've been working that company for. You've been if you work there for 5 years, your benefit plan might get better, and it also depends on different insurance companies like Blue Cross or Sun Life, Green Shield. It all depends on what kind of fee guide they are actually following.
Right. Mm-hmm. Okay. How can people find out what's covered by their plan?
With some dental insurances, they can give us their policy number and ID number, and we can find it out for them. Some insurance companies, they actually give us the breakdown of what is covered right away. But some insurances, they don't, and they get mailed to their own address, and that's when they find out how much is covered. Or I've seen a lot of people going onto their website and logging in and just finding out what is covered at, like, what's the percentage or what's the maximum amount, and they just find it out on their own.
Mm-hmm. That's great. It's all accessible for sure.
Yeah.
What is the Alberta Dental Fee Guide?
So this dental fee guide is an annual suggested fee guide for dentists in Alberta. So they have many different codes that gives a breakdown of what kind of fee guide or like how much each treatment is going to cost. And it's just a overall just outline of how much the treatment or what kind of code is covered at and what is covered and what is not. So it's just a general fee guide of all the treatments that the dentist provides.
Okay. And do all dentists base their price on that fee guide?
Well, honestly, I'm not gonna talk on behalf of other dentists, but the tooth doctor, we do try to follow the fee guide. You know, we don't want to go too over or too under. We also look at the fee guide definitely as well. But the dentists are not required to follow this fee guide. It is just a guide only. It just gives us the kind of like a general idea of what the Alberta fee guide is. So it's not where the dentist needs to follow the fee guide, but it gives us a general idea. And also we kind of try to go along with what that kind of fee guide is. So yes, it also differs every year because like I said earlier, they give out an annual fee guide. So, you know, annually the dentist or our office might change annually as well, after looking into that dental fee guide.
Okay. And what can people do when they don't have employer dental plans?
At the Tooth Doctor, we actually provide a lot of consultation for patients. You know, like I said earlier, we talked about, you know, cost is very, you know, it's like a kind of like a sensitive, you know, question. And, you know, it's just really hard to say this costs like this, you need to come and pay this. Like, you know, it's a big surprise at the end of the treatment if they say, oh, you owe like a couple $100. So, you know, we actually encourage patient to come in and have a consultation with our dentist. Just sit down and, you know, just get to know each other, and the dentist will take a quick look and kind of give you an assessment of how much this whole treatment is going to cost, you know, in advance before just saying, oh, we've done this, you need to pay this, you know. So we encourage patient to come in, like even if you don't have dental coverage, we encourage patient to come in, you know, get to know our dentist and have a seat and get a little bit of assessment so we can give you a more descriptive information on what you need to do and how much it's going to cost and all that kind of stuff.
Oh, that's great.
So yeah, that's really great for our doctor to just, you know, have a sit down, take time with their patient, and kind of go over with like those like big things of like what you need to do, how much it's going to cost. Take your time, book back, and
get a plan.
Get a plan.
That's great. Do most dentists set up payment plans for people without dental coverage?
Well, once again, I'm just going to talk about what we are doing at the Tooth Doctor, our office. We do actually provide some, you know, plans for people who are kind of financially sensitive or, you know, people who don't have dental coverage, and, you know, but we try to build a relationship with both the staffs and the patients, with the dentist, with other staff members. So, you know, that's why I'm encouraging patients to come in, get to know our dentist, so we get to know you as well. Like, you know, we can't, you know, if it's your first time, we can't just, okay, you do this, you can come back after a couple months to pay. It doesn't kind of work like that. We need to know, we need to know the patient, we need to know what kind of situation they're in. And, you know, if they say, oh yeah, my coverage is covered at 80%, for the remaining 20%, is it okay if I come back in a couple weeks? Okay, is it okay if I clear the balance when I come back for another treatment? You know, with that kind of stuff, we're not really strict on like, no, you need to come like at the end of the week to pay. We're not really strict on that kind of stuff. But, you know, it's important for us to trust them as much as the patient's trusting us, right? We both need to trust there. So we're trying to help them by providing payment plans, by putting down their credit card information, saying, yeah, can you take it out maybe once a month, or, you know, that kind of stuff. With like big stuff like ortho coverage, those ones are more expensive than the other treatments. So yes, we do definitely provide a payment plan. That's why we encourage patients to, you know, not think about the cost for as their first thing. You know, obviously health, like oral health is like the most important thing. So
that's actually a very good point. Thank you so much for answering all these great questions.
No
this is actually very informative. Brings down some of the anxiety that someone might have if they're not sure how much it's going to cost. So thanks for joining us here at YouTube channel for the Tooth Doctor here in Edmonton. Don't forget to like the video, like the channel, subscribe so you can stay up to date with all the current information taking care of your teeth. Thanks guys. Bye.
Bye.